Development Executive from Communicare 247. And today I'm joined by Brian Duffy from Glasgow, who works collaboratively with both the Wheatley Group and the Health and Social Care Partnership in the city. So Brian, hello. And before we begin, could you just give us a little bit of an overview into your career history within the world of care?
Hello, Ashley. Yeah, that'd be quite easy. So I was thinking this morning before we come on that I've been in the care industry and care-related industries for around about 35 years, which is quite a long time.
Yep.
And in that time, I've worked across criminal justice, children's services, older people services, addiction services. So I've got quite an extensive range. I've also worked within learning and development and a few care-related organisations. And I've also worked at Scottish Government around about information systems related to care.
Wow, that's a lot. And in terms of, your experience with technology, how do you see technology as it's evolving now really assisting people remain independent and it's useful within the care environment?
A single word answer, which you'll be delighted to know, and that's choice. I think that technology supports choice. I think what we are involved in is in the job of supporting people to achieve their own outcomes.
Absolutely.
Whether that outcome be being feeling safe at home or whatever. And technology for me, quite simply, increases the amount of choice that we can give to people. Yes. In terms of helping them to reach those personal outcomes.
Absolutely, because of course one size doesn't fit all, and having
Exactly.
That choice provides people with a bit more flexibility, if I can say that, around their own care planning, because that equally is important. Absolutely.
Yeah, indeed.
So in your opinion then, and your experience of using different technology, is there any improvements that could be made to the current offering from lots of different providers?
I think if you drilled right down, there could be an endless amount of improvements. But I think the major improvements need to be about the whole human-computer interface, the user experience. We've not quite got to the end of that, so it's still not quite as intuitive as it is to get your money out the hole in the wall at a bank. Yep. And hopefully care-related technology can mature to that level in the future.
Yeah, no, absolutely. I think we're all working towards evolving and growing each day, week, month and year. But of course, the use of technology, it allows us to gather a lot of data. And to quite a lot of people, that data is very important so that we can constantly assess care plans and I suppose intervene to prevent certain circumstances arising for clients and citizens. But in terms of how that data is shared, do you have any thoughts about how that could perhaps be improved at all?
Oh, that's a difficult question. It's a perennial question about information sharing. I think a starting point, and it may be quite a radical starting point, is to think about where the information should reside. And for me, the information should always reside with the individual themselves. Yes. So there's been talk in the past about, if you like, the idea of having a backpack of your own information, whether that be health-related information or care-related information. Yes. And that information will be shared with relevant people at relevant times and be used simply for the purpose that you've engaged with that organisation. The idea of all these silos of information and people having to request their own information, I think those days are fairly numbered. Yes. And hopefully we'll move to a much more mobile. Certainly I know in Europe that you can present at any GP because they have access to your information from a central repository, which you give them access to.
Absolutely. So not only do the relevant people, within your care plan have access to that, but you do as well. Absolutely.
Yeah. And then it's you that give people permission to use that data.
Yes.
And it's only shared with your permission.
Yes. Absolutely, which I think is definitely important and definitely key moving forward. So I'm going to take us back to a little bit of an earlier part of the conversation, thinking about of your role within health and social care. How does this technology support you within your role as somebody with a duty of care?
Again, I mean, I've said that choice, but the other bit with choice is flexibility. Mm-hmm. So that provides that flexibility to deliver care to different people in different ways, which is most appropriate to them.
Yes.
The technology is always developing. But if we think back, I mean, 100 years ago, care and health was being transformed by the use of simple things such as the bicycle, the internal combustion engine for cars, and also the development, telephones made. So technology, we've always harnessed technology and tried to be more efficient and try to provide a better service in terms of people. But again, I would say that the thing that technology underpins everything is choice. We give people real choice in how they want their care delivered to them.
Absolutely. And of course, the outcomes that comes from using this technology for each individual. And thinking of outcomes, can you provide any examples of a positive influence that the use of technology has had on amongst some of the citizens that you might have worked with in the past?
Well, there's a whole range of things. I mean, one of the major challenges for us is the awareness of conditions such as dementia and the experience of people while they live with dementia, and also how their families are living with dementia. So we've seen a whole range of small-scale technologies that allow people to go out safely during the day and their families know where they are. We've seen the development of technologies which can sense if people are in the home and which will alert people if people leave the home. So all these sort of, and I think we're very much at the beginning of using, if you like, the Internet of Things to develop these technologies, but we are getting there. And again, that's providing greater safety for people. And also I think, which is also really important is the reassurance it provides for families and carers who in many circumstances see care homes and see hospitals as providing respite for them.
Yes, absolutely. And I can actually share a sort of personal story around how the use of technology can ease the worry that some, family members would have. My own gran is living with dementia, and, my mum is our main sort of named carer. But, ultimately when my mum works, she's not there with my gran, and that at one point made her really full of anxiety. But thankfully, with the use of telecare equipment, she now feels more at ease because she knows that my gran can call for help as and when required. So absolutely, it has many, many benefits. Yes. And just, on a kind of final note, Brian, if you had a bit of a magic wand and you could create this all singing, all dancing piece of equipment, is there any ideas or thoughts that spring to mind?
Yeah, the thing that always springs to mind is Homer Simpson's car. If you remember the episode of The Simpsons where his long-lost brother came back and allowed him to design a car, and of course it was rubbish. So that's a bit like asking me that question. I feel as if whatever I would suggest would be wildly off the mark. I think, no, the pace of change and things that we don't know about, the unknown unknowns, will create new systems for us in a very short space of time. And if you think about, when people used to emigrate, we didn't see them for years on end. I'm old enough to remember famous things such as airmail letters, which came from relatives in Canada and Australia. And now if you want to speak to someone in Canada, Australia, you press a button on your desktop and you're instantly talking to them.
Absolutely.
So do not take my advice on how to design things. I think we'll evolve.
No worries. Well, thank you very much for your time today, Brian. I really appreciate that.
Thank you. It's been a pleasure.